Yeah, I think that's a big thing for us, especially as a not-for-profit faith-based organization. I mean, we have such a huge role in community health and community outreach that I'm so incredibly proud of in Richmond and all of our other markets as well, where we have a presence. And I think this is a fantastic question, and one that even the federal government is putting a lot more weight in lately, which is exactly what it needs to be doing, is how do we address social determinants of health early on? And I know for Bon Secours Mercy Health, what we've done is we've used our electronic medical record to actually start asking questions upfront at times of admission and times of presentation to really start figuring out what those social determinants of health are in a very concise and crisp way, that actually then triggers additional resources or additional things that are needed based on what the patients are saying they need from a social determinants perspective. And so we've tailored those questions using feedback from our patient and family advisory councils, from our community health needs assessments that we do in all of our different markets, and we tailor those questions to be able to try to gain some insight. And then we have things built into our electronic medical record that actually trigger interventions and different consults based off of what our patients are answering. So I think we're getting better and better at starting to ask the right questions. Many times, if you just ask somebody if do you have enough, do you have a roof over your head? Well, yes, they might have a roof over their head, but do they have air conditioning or do they have heat? And I think digging into those questions a little bit more is what we need to do, because I think patients sometimes get embarrassed about that, or families, and how do we make it comfortable for them to where they trust us in the healthcare space to be able to be their advocate and find, those resources for them. And, taking that one step further is that's how we're addressing it in the beginning and interventions on the inpatient side. But at Bon Secours Mercy Health, what we really pride ourselves in is the being a part of our community. And we engage with those leaders. We do our community health needs assessment with different members of our community, and we meet them where they're at. So if things like a food, where they're isolated from food desert is occurring, then we have actually brought in grocery stores, essentially mobile grocery stores, to be able to help that community. In one of our areas here right outside of Richmond in Petersburg, Virginia, that was an area that we identified as many patients were hungry and they were in a food desert. And so we actually had to create a mobile grocery store for them that goes out there certain days a week to be able to offer food in the community that is affordable and or based on their ability to pay, so we can make sure we provided that resource for them. And in another market, I know that we have gardens that are actually that are manned and actually taken care of by community members and volunteers. But that's where they come and they harvest their fruits and vegetables, and they are members of that kind of food co-op that they're doing. And so we do a lot of that with our communities to be able to meet them where they're at. And I think that's just such an amazing thing about working for this organization, is that engagement with our communities, is to where we like to be a part of that solution and listening to them to see what they need versus us assuming what they need and not really being a member of that community. So I think that's something I'm so proud of in this organization that we do, is that community partnership here.